4 parts. There's basically 4 parts or 4 stages. Stage 1 is your deductible, if it's applicable on your plan. Okay. Stage 2 is what they call your initial coverage period. That's the amount of coverage that you'll have before you reach stage 3, which a lot of people cringe at, which is that what we call the donut hole or the coverage gap. Right? When you hit that donut hole coverage gap, people become upset because it can get costly in that. And then once we get out of stage 3, we go into what we call catastrophic coverage, which I'll show you guys the new chart here for 2019, because there are some changes in 2019 on Part D in comparison to what we have right now in 2018, okay? But it's important to know that less than 7% of beneficiaries ever reach their donut hole. In most cases scenario, it's just making sure that they have the right plan. And sometimes you can eliminate that situation from a lot of people if they just had the prior knowledge in terms of what plan was, best for me at that time. Yeah.
Did you say starting in 2006, after that, anybody that had Medicare was already enrolled in Part D?
Right, like anybody that was a Medicare beneficiary as of like 2006 had to enroll or had to have some either Part D or have credible prescription coverage.
Right. They don't have it automatic. You have to enroll.
You had to enroll.
I think that's what she's asking.
Yeah.
Is
But
it
some people may have had it
automatic?
automatically. Like if you were a retiree, you probably always may have had it. So it wasn't something you had to actually do because you've already had it prior to 2006. So here's kind of the new chart that was updated annually. And you can see that although not all plans have a deductible or their deductibles may change, the standard deductible for Part D was $405 last year. And they bumped it up to $415 this year. So that was at stage 1 that we kind of talked about. That's your deductible, stage 1, okay? And there are different plans that don't have deductibles, so I'm not saying that everybody has this deductible, but the standard deductible is $415. And then you go into what we call stage 2, which is your initial coverage period. So the total cost of your drugs, okay, up to $3,820, which is a small increase from last year. I think it was $3,750 last year. It's went up to $3,820 this year. Once your total cost of drug, not what you pay, not what the insurance company pays, but what the total cost of your drug is, okay, reaches the $3,820, you go into what they call the coverage gap and or the donut hole, okay? And that's one of the big changes that had happened for 2019. There's a little bit more of a threshold. So as you can see on the enrollee side, one of the big changes that I liked is that the enrollee only pays now in the donut hole 25% of the brand name prescription drug. Because most generics are not going to get you to the donut hole, but the brand name drugs can be very expensive. And last year, most of the participants had to pay 45%. Now this year, they have to pay only 25% in the donut hole. So I think this year is really important. If you're someone or you know someone that is taking a few prescriptions and are having some trouble with cost, this year would be a good year to review your plan options because the donut hole had changed. So there may be some options that are available to that person where they'll be able to hopefully maybe get into a different plan or maybe get some more coverage with a different plan. So it's a good year for prescription drugs. So if you know someone that's paying a lot on prescriptions, this might be a good year to review that option with them. Okay. And extra help. I can't tell you the numerous times that we meet or help individuals, and they don't know that they qualify for extra help. Extra help is a state program which they can help pay for your prescription drugs. Okay. Not only will they help pay for the deductible, but they'll also help pay for your copays and your premiums too as well. And these are different qualifying events, and we can talk about those numbers in more detail at a different time, obviously. But just because you qualify for extra help doesn't mean you're on Medicaid, or doesn't mean you have no money. There are people that qualify for extra help that are not considered Medicaid eligible individuals. Okay, so extra
They
help
just don't have money.
is someone that anybody can apply for. Okay, so it doesn't have to be, you don't have to think of yourself as, oh, I have to make zero money. That's not the case with extra help. And I see that a lot helping out, and I find a lot of people sometimes qualify for that, and they didn't know that, right? And they're paying all these years for things that they could have been saving on, okay? So that's another reason why it's always important to review your Part D options too as well each year. Now, what are my options? Now, I get original Medicare. So we had talked a lot about Part D, which is here, and then we talked about A and B. So when I go on to original Medicare, I can go one of two directions. I can get a Part D plan coverage, okay? And then once I have Part D, I can buy what they call Medigap or Medicare Supplement. So that's an option. So Medigap and Medicare Supplement are the same thing. Okay, I know it can be a little bit confusing, but those are the same type of plan. Or my other option is I can enroll into what they call a Medicare Advantage plan, which will work like an HMO or PPO, which maybe a lot of us are familiar with because we work for companies and maybe we ran companies, and we had HMOs and PPO options as employees our whole lives. Okay, that's kind of what a Medicare Advantage plan does, and usually it will include the Part D coverage as part of the program. Okay, so today what we'll kind of discuss is what's the difference on what is it, not really a difference, what is a Medigap plan versus what is a Medicare Advantage plan. Okay, because those are two directions that you have to choose not only each year during the annual enrollment period, but also an important thing to choose when you're going on to Medicare, for the first time. That's going to be a big decision that you have to make, okay? So Medicare Supplement or Medigap, okay, is probably the most traditional option that's been around the longest. I think Medicare Advantage, and I'm not 100% sure, but I think Medicare Advantage came along around 99, 2000, 2001-ish. It was right around that first era, so it hadn't been around as long as what traditional Medicare Supplement Medigap had been. But this is where you pay monthly premiums to an insurance company, okay? It does not include Part D, as we had mentioned before, because you have to buy a separate Part D program with a Medicare Supplement. So if you look here, we're talking about Medigap, and then you have to have a separate Part D, okay? And the modernized plans, there's a lot of options, and that's what kind of can make it confusing when you're trying to pick a letter, because you get enamored with all these different letters. But as you can see, there's a lot of different Medicare Medigap plans, but the most popular are what they call Plan F, Plan G, and Plan N seem to be the most popular amongst these beneficiaries, okay? And it's important to note on Medicare Supplement that Medicare is your primary and your Medigap is your secondary, okay? So you still have original Medicare, but the gap is your secondary coverage, okay? So that's how Medigap works. And that's when you hear the letters F, G, and N, that's a Medigap policy, okay? So you can see there that there are options to choose from, and we're not going to discuss every option because it's different for everybody when it comes down to decide which plan would be, best for me. But you can kind of see what the table or chart looks like. And that chart is also in your Medicare. So we all get that, if we're on Medicare, we get that Medicare for You book every year. That chart's in the Medicare for You that's sent out to everybody, okay? So, if you have go ahead.
Am I understanding correctly that if you have Medicare and pick a Medicare gap,
Mhm.
you don't need a supplemental insurance?
Well, the Medigap is a supplement.
So like if you had Humana or Blue Cross or something
Mm-hmm.
else, you could cancel that and just get the Medigap?
Well, Medigap would be administered by a private insurance company. So for example, Blue Cross has Medigap, ARP has Medigap, Humana has Medigap. So yeah, it's Medigap, but it's still administered by a private insurance company.
Okay.
Yeah, you're right. Yeah, exactly. Okay. Oh, so questions on Medigap? Yes, go ahead. Yep, so there is a United Healthcare ARP supplement that's considered Medigap.
Okay.
It's confusing because if we went back to that chart there, it's Medigap and then see in the parentheses, Medicare supplement insurance policy. It's how they brand their product, but that's what I was trying to say, like Medigap is the same word really as Medicare supplement.
But if you went with the Medicare premium, the same as you went as if you were to go with the ARP. Is the premium the same or is it different?
No, there's different premiums.
No, based on the letter, there's different
There's-
premiums.
yup.
Yeah, but I mean.
And based on the company.
But if you went with the Medicare,
Mhm.
is that a different premium than if you were to go under like a separate supplement? Like
No,
AARP?
So Medigap and Medicare supplement are the same. So you like, let's just say you had ARP for example. Okay, so ARP is a Medicare supplement. It's also a Medigap plan.
Okay,
It's one and the same. So it's not a different plan or a different premium.
okay, so the premium.
They mean the
is
same thing. Yeah, they mean the same thing.
Okay.
Yeah, they mean the same thing. But that's a good point you brought up, is because not every, now Plan F is Plan F. Like for example, we look at Plan F. Plan F is Plan F, but what will differ is